Welcome back guys. Now in this video, let's discuss about different causes of dementia. Okay. So our topic is dementia. So what exactly is dementia? Okay, dementia, you know it is memory loss. Okay, memory loss. In a simple way, we can say dementia is memory loss. So that patient who is having dementia, they are going to have some features. What are they, sir? They are going to have something called as aphasia. They are forgetting something. What exactly they are forgetting, sir? Aphasia means inability to communicate properly, inability to talk. Okay, so inability to communicate because they are forgetting what? They are forgetting words and they can't understand. Okay, they can't understand. See, if you are talking to a person who is having dementia because of any reason, maybe he's having Alzheimer's or maybe he's having Creutzfeldt-Jakob disease or Pick's disease. Okay, now when you talk to them, they will pretend that they are understanding. They can't even understand. They just nod their head. Okay, but they are not understanding. So that is aphasia component. Aphasia component means they can't talk and they can't even understand because they are forgetting the words. They don't know the word. Okay. Next, they'll be having apraxia. So what exactly is apraxia, sir? Inability to perform the pre-programmed movements. Okay, so the person already know how to execute that movement, for example, like running or just riding a motorcycle or just doing a somersault. Okay, he previously knows how to do that movement, but now after getting this dementia, he forgot how to do it. So apraxia means inability to do pre-programmed motor tasks. Okay, they can't do the thing. Okay, they can't even do their job, and they, in severe cases, they forgot to even do chewing. That movement, that's a motor movement, swallowing, and even walking. Okay, there will be diffuse cortical atrophy that's going to occur. So they even forgot to do these movements, how to perform these movements. And the next A that I'm going to discuss is called as agnosia. Okay, agnosia. So apraxia is going to be there, aphasia is going to be there, and agnosia. So what exactly is agnosia, sir? It's the inability to properly interpret the senses. Okay, inability to interpret senses. So they can't, for example, when they look at the people, for example, if you show the people, if you show a picture, photo to this person of someone who is his relative, he can't recognize them. He can't recognize them. He cannot, just means the visual sensation, he cannot properly interpret who that person is. Okay. Or you can say he cannot recognize the people and he cannot even properly interpret the pain sensations also. Okay. So can't recognize people. He can't even interpret pain. Okay. So at the end of the day, what I want you to know is, if a patient is having dementia, he's going to have symptoms like aphasia, apraxia, agnosia, all these things are going to be seen. So how to put the diagnosis this patient is having this dementia? The test that we are going to do is called as mini mental status exam. Okay, simple MSc mental status exam. Here we are going to ask the person to do certain things. There is a scoring system. Okay, out of 30, a normal person should get a score more than 27. A score more than 27 out of 30 indicates he is normal. Now, if a score less than 27, if the score is less than 27, then we can say he is having dementia. So what are the kind of questions that we are going to ask here? For example, simple like, we are going to say a word and we are going to ask this person to repeat after us. Okay, we are going to give a spelling. We are going to ask him to say the spelling in backward. Okay, the spelling of a word in backward. So, subtraction, serial 7 subtraction. Okay, we are going to say 100. So, after in that 100, he is going to subtract 5, 5, 5, 5, something like that. So, these are the kind of questions that we are going to use. Okay, or we are going to ask a person to draw an object. Okay, we are going to show an object and we are going to ask the person to draw it, because he is having this memory loss, right? He is having very weak memory, so he cannot draw. After, for example, I am going to show an elephant and I am going to ask him to draw. So, as he is having a very poor memory, he cannot draw. Okay, so these are the things which are going to be checked in mini mental status exam. So, for the causes, now let's discuss about the causes of this dementia. Causes, the number one cause is Alzheimer's disease. Almost 60% of the cases it's Alzheimer's disease. Apart from Alzheimer's, the second most common cause is going to be multi-infarct dementia. Multi-infarct dementia. Because of strokes, focal small strokes. Okay, multiple times stroke is occurring, so that's what is going to cause the dementia. Okay, it's because of stroke. Or the other causes like Lewy body dementia. And rare causes include Pick's disease. Okay, Pick's disease. Next, Creutzfeldt, Jacob disease. Okay, even HIV can lead to dementia, encephalitis, dementia, and vitamin deficiencies. Okay, vitamin deficiencies like vitamin A, B, not A, C, E. These are like antioxidants, right? Whenever you are having deficiency of these antioxidants, so free radical damage can occur. That free radical damage can cause the damage to the neurons that can lead to memory loss, and even Wilson's disease. Where excessive copper accumulation is going to cause the hepatolenticular degeneration. So at the end of the day, the important point which I want you to know is the most common cause of dementia. The most common cause of dementia is Alzheimer's disease. So first let's discuss about Alzheimer's disease. What exactly is happening in the Alzheimer's disease? See, in Alzheimer's disease, there is degeneration of. Okay, in Alzheimer's disease, there is degeneration of cortex. Okay, the cortex is getting degenerated. As the cortex is getting degenerated, if you look at the gyri and sulci, okay, so the gyri are going to be thin. Gyri becomes thin and sulci becomes wide. So widening of sulci and thinning of gyri is going to be seen on autopsy. Okay, after the death of the person, if you see a patient, if the patient is having Alzheimer's disease, he is going to have thinning of the gyri and widening of the sulci. At biochemical level, what is the problem? Is there is a decrease amount of acetylcholine. Okay, there is decrease amount of acetylcholine. See, this acetylcholine is very much important for the memory. Very much important for the formation of memory. So that acetylcholine levels are going to go down. Acetylcholine levels are going to go down. Okay, where exactly? In the basal nucleus of Maynard. Okay, the basal nucleus of Maynard and hippocampus. So in this region, the acetylcholine levels are going to go down, and that is associated with the memory loss. So what is the treatment that we are going to do? So for the treatment of Alzheimer's, we are going to simply increase the acetylcholine levels. So that is the treatment. Okay, keep that point in mind. So there is cortical atrophy is going to be seen, cortical degeneration, decrease in the amount of acetylcholine. Okay. Not only this, some histological changes are also going to be very much appreciated. Which histological changes, sir? What is that? Now, I want you to know, in the neurons, normally there is a protein called as amyloid precursor protein. So there is amyloid precursor protein, simply called as the APP. So the gene for amyloid precursor protein is present on chromosome number 21. Remember this, very important. Chromosome number 21, there is a protein called as amyloid precursor protein. It's present on all the neurons. It's present. Now this amyloid precursor protein, it's going to get breakdown into beta. Okay, beta, pleated from beta breakdown product. Okay. Now that is going to be later converted into alpha, beta, amyloid. This A beta amyloid means abnormal protein. See, this abnormal protein is going to get accumulated in the central nervous system. So this is simply called as the A beta amyloid. Okay, A beta amyloid. At the end of the day, what I want you to know is, so this amyloid precursor protein, if it is converting, okay, if it is converting into this A beta amyloid, this A beta amyloid is going to accumulate in the central nervous system, and that's what is going to cause Alzheimer's disease. Here, the point which I want you to know is, there is a gene called as apolipoprotein. Apolipoprotein E. Okay, apolipoprotein E gene is there. It is having multiple alleles. Epsilon allele, okay, epsilon type 2 allele is going to inhibit this process. Okay, epsilon type apolipoprotein, epsilon allele 2 is going to inhibit this conversion. There is apolipoprotein E, epsilon allele type 4 is going to promote this conversion. Okay, it's going to promote this conversion. So at the end of the day, what I want you to know is, if this amyloid precursor protein, because of some reason, if it is converted into, while during breakdown, if it is converted into this type, A beta amyloid form, that A beta amyloid is going to accumulate in between the neurons. In between the neurons, that's what is going to cause the neuronal degeneration. Neuronal degeneration. That neuronal degeneration is the one which causes the Alzheimer's disease. Okay, this is the one thing which I want you to know. Apart from that, okay, apart from that, what else you should know is, see, this chromosome number 21, I have said you this chromosome number 21 is important. Who is going to get the Alzheimer's disease? Usually Alzheimer's disease is going to be seen in elderly. Okay, in elderly people, somewhere around their 70s, 80s. Okay, 70s and 80s, the patients are going to get this memory loss. Alzheimer's, that's okay. But if a patient is having a Down syndrome, okay, if a patient is having Down syndrome, see, Down syndrome means what? Trisomy 21. Trisomy 21 means there are 3 copies. There are 3 copies of 21 chromosome. So what, sir? 21 chromosome have a gene called as amyloid precursor protein. More genes, more chances, more protein. More protein means more chances that it can convert into this form. Okay, well, it's getting broken down. It's going to become A beta amyloid, and this A beta amyloid plaques are going to accumulate in between the neurons, which causes the neuronal degeneration. So that neuronal degeneration is the one which is going to cause the cortical atrophy, or the degeneration of the cortex, which will lead to Alzheimer's and memory loss. Now, how to look at this A beta amyloid? How to know, okay, the patient is dead, and we are just suspecting that he is dead with the Alzheimer's disease. Okay, after death, we want to know whether he is having Alzheimer's or not. See, this A beta amyloid is there, right? This A beta amyloid, you can stain it. Okay, what is the stain used for this amyloid is Congo red. Okay, Congo red. So if you do this, stain Congo red, the A beta amyloid is going to be seen outside the cells. It's the extracellular. These are extracellular things, not intracellular. Extracellular means outside the neurons, you can see this A beta amyloid. Now, if you put some polarized light, okay, if you put some polarized light, this amyloid protein is going to show apple green birefringence. Okay, apple green birefringence is going to be shown by the A beta amyloid. These are some important points which I want you to know. Apart from this, is there anything which we can appreciate under the histology, sir? One thing is very much appreciated. Okay, one thing is very much appreciated. That is A beta amyloid. Okay, that is extracellular. Inside the neurons, can we say something? Intracellularly, what we can say is, there is something called as a neurofibrillary tangles. So what exactly are these neurofibrillary tangles? These neurofibrillary tangles are nothing but hyperphosphorylated. Okay, hyperphosphorylated tau proteins. These hyperphosphorylated tau proteins are called as neurofibrillary tangles. They are present within the neurons, inside the neurons. You can actually see it. So I have already said you the Alzheimer's disease, it's a disease of elderly, but in which younger age groups you can see this Alzheimer's disease? See, early disease, okay, early disease is going to be associated with the Down syndrome, okay, Down syndrome, and it's going to be associated familial Alzheimer's is going to be seen with the mutation of presenilin 1 and presenilin 2 gene mutations. Okay, presenilin 1 and presenilin 2 gene mutations can lead to familial, okay, familial form of Alzheimer's disease. These are some important points which I wanted. So, which chromosome is associated with Alzheimer's disease? Chromosome number 21. Which genes are associated? Presenilin 1, presenilin 2, apolipoprotein E gene, and which protein? APP. Okay, amyloid precursor protein which is present on the neurons. It can be converted with the improper breakdown. It is going to be converted to A beta amyloid, which is going to stain with Congo red and which is also going to show apple green birefringence with polarized light. Okay, polarized light. Now, what else you should know is what are the drugs which are used in the treatment? The drugs used in the treatment, the number one drug is called as mementin. Mementin. So, what exactly is this mementin, sir? It was thought that the glutamate, the excitatory neurotransmitter is also one of the reason for cytotoxicity, for the neurodegeneration. In Alzheimer's, it's thought that the glutamate will show excitatory neurotoxicity. Okay. So, we are going to block the receptors. Block the glutamate receptors, and that's going to be done by a drug called as mementin. So, mementin is a glutamate receptor blocker. What is the glutamate receptor? NMDA. NMDA is the glutamate receptor. So, NMDA blocker is mementin that can be used. But what is the side effect of this mementin is hallucinations. Okay, the patient can get confusions and hallucinations. These two are side effects. Apart from that, what else we can use is this is the one drug, but the drug of choice for most of the cases is three drugs. They are donepezil, galantamine, and rivastigmine. So what exactly are these? They inhibit, the mechanism of action is they inhibit acetylcholine esterase. Okay, acetylcholine esterase. So what these acetylcholine esterases are going to do? Acetylcholine esterases are going to break the acetylcholine. Okay, they are going to break the acetylcholine, right? So when you inhibit the acetylcholine esterases, they increases the level of acetylcholine. So that's the problem. The problem is treated. In Alzheimer's, the acetylcholine levels are going to be low. So you have to increase the acetylcholine. So how you can increase the acetylcholine levels? By inhibiting the acetylcholine esterases. By using the drugs like donepezil, rivastigmine, and galantamine. Apart from this, you can also use antioxidant vitamins like vitamin E, which is an antioxidant which prevents the free radical damage of the neurons. Okay. So these are some important points which I want you to know regarding dementia. The most important cause of dementia is Alzheimer's. Apart from Alzheimer's, the second most common cause is multi-infarct disease, Lewy body dementia, Pick's disease. They are also rare causes. Okay, so most of the time, these patients who are having Alzheimer's disease by 60-70 years, they will have this memory loss, they will get apraxia, aphasia, agnosia, they will simply forget about their surroundings. Okay, they can't like recognize the people. So if you just leave them, okay, If you are not properly taking care of them, they will simply go out of the house and they are gone forever. That's it. Okay, you are never going to find them because they will simply go away to some other place and you are never going to find them. Okay, that's a main problem with the Alzheimer's. Okay guys, with this we have completed the topic of dementia. The most common cause is Alzheimer's. Hope the video is helpful. Thank you.